Welcome to Monday's edition of COVID-19. I'm Min San-hee. We are starting the work week with daily cases in the 300s amid an ease in restrictions on social and business activities starting from today. Also today, authorities are poised to share more details about their upcoming inoculation drive. But first, I have our consul standing by with the broader pandemic updates. So I'll just start us off here in Korea for this Monday.
All right, Sunny, we are back from the holidays, but not much change in the COVID-19 trends. This Monday, we have 344 new cases of the COVID-19 cases confirmed, and that is 323 domestic transmissions and 21 imported cases. And that raises the total here in the nation to 83,869. The death toll at 1,527, with 5 more people having lost their lives. Now, in recent week, daily tallies were in the high 200s to the low 500s, just like in the span from last Monday to this Monday. And with the worst of the third wave of the pandemic deemed to be over, social distancing measures have been downgraded for the first time in around 2 months. Now, the government announced on Saturday that the Seoul metropolitan region social distancing measures have been lowered by a notch to level 2, which is the third highest of the 5-tier system, and to level 1.5 in the rest of the country. So for the metropolitan region, that means restrictions on operating hours at some 48,000 businesses, including theaters, PC rooms, and cram schools, have been lifted, while restaurants, coffee shops, gyms, and other public use facilities that were previously and quite recently allowed to open until 9 p.m. can now operate their businesses for another hour. Nightlife entertainment venues that were categorized as high-risk facilities are also permitted to open until 10 p.m., but under strict prevention guidelines. The ban on private gatherings of 5 or more people remains, but it's been lifted on gatherings among immediate family members. So these downgraded social distancing measures are now in effect beginning this Monday, and the daily figures do meet the criteria for this downgrading if we take a look. Now, in the metropolitan region, however, still almost 80% of cases this Monday were concentrated here, with 151 cases in Seoul and also more than 100 in Gyeonggi-do province. So officials say we will still have to take a look in the progressing weeks, also because we had some movement over the Seol, or the Lunar New Year holiday.
Right, so we did. Meanwhile, what is the latest on the international front then?
Well, Sunny, scientists say that 7 new variants across the U.S. have been detected, which seem to have been originating from the U.S., but it's not clear yet whether they are more contagious than other strains of the virus. And also, experts in the U.K. say that the U.K. variant might be deadlier than we thought before, while earlier it was only known to be much more contagious. However, despite variant concerns, vaccination programs are progressing around the world in many places. Daily figures are on the decline, including here in the U.S. But over the extended weekend that we had here in Korea, we saw figures in Russia and the U.K. surpass 4 million, and also Argentina became the 12th country to hit over 2 million cases. And the total number of infections around the globe stands at almost 109.4 million. But we do see a decline in the daily increase. In the past 24 hours, as of noon Korea time, we see 285,000 infections. But we do have to factor in that the number could be lower because it is Monday. And I'll be back after the government briefing in a bit. Sunny?
Right, so thank you for now. I'll see you later at the desk. Right, come next week, the first shipment of COVID-19 vaccines will arrive in Korea. So today, to learn about the protocols involved in such shipments, we turn to Belgium, one of the production sites of the Pfizer vaccine. I have Gov'T Gerrans, the director at Air Cargo Belgium, with me right now. Welcome, Mr. Gerrans.
Yes, good morning.
Right, I understand Belgium has been shipping vaccines to countries across the world for the past 3 months now. How many doses have been delivered thus far?
So far, I think about between 20 and 30 million doses have been shipped through Brussels airport. It started in November, and we had about 150 flights leaving from Brussels carrying Pfizer vaccines on board.
Mr. Gerrans, Pfizer Pfizer's vaccine needs to be kept extremely cold. Tell us a bit about the infrastructure that has been set up to ensure the cold chain.
Of course, we need fast transit times at the airport, and therefore we have installed about 30,000 square meters of refrigerating capacity, meaning in different temperature zones. Most of them are just refrigerator temperature between 2 and 8 degrees, but we also have minus 20 degrees refrigerator storage capacity, and then ambient temperature between 15 and 25 degrees. About 15 different companies have installed these refrigerators or had them already, because Belgium has got a lot of vaccine transports to Africa also in the past, but also 10 new companies are developing extra infrastructure, especially for these vaccines.
I see. Mr. Geerens, for how long can these refrigerators safely store these vaccines?
Of course, we need fast transit times at the airport, what I said, but like, for example, the Pfizer vaccine, which needs to be stored as minus 70, is kept at the airport at the normal refrigerator temperature between 2 and 8 degrees, but they're packed in boxes of about 40 kilograms with dry ice. And then these packages have been designed especially to keep the vaccines for about 10 days in these boxes. After 10 days, these boxes can be refilled with dry ice, and that can be kept, let's say, up to about 1 month. Afterwards, they have to be stored in normal refrigerators for 2 to 8 degrees, but then they have to be used within 5 days. So maximum storage about 1 month, and then to be used within 5 days.
I see. Meanwhile, Mr. Geerens, very generally speaking, what are the protocols involved in transporting vaccines via air routes?
Of course, very important to safeguard temperature, no deviations. That's the most important one. On the other one, the integration of the boxes itself so that there is no damage. We have special protocols for that and special SOPs. And then also on security, there's also possible fraud and theft of these. So we work together with the different government agencies who control these things. And we've got procedures in place to make sure that everything is kept at perfect conditions. At board of the aircraft, there are limitations for dry ice. Some airlines have extended or augmented the capacity that can be transported on board. But dry ice is considered as a dangerous good, which is dangerous for people. So there are limitations for transporting dry ice for the Pfizer vaccine on board of these aircraft.
I see. Korea is poised to secure its first shipment of Pfizer vaccines next week, Mr. Geerens. Have you had any exchanges with airport officials here regarding the upcoming shipment?
Yes, we're talking to Korean airlines and some airlines flying to Korea, and we expect indeed them to start very soon. Last week we started already with flights to Narita to Japan for the Pfizer vaccine, and Korea is planned for next week.
I see. One final question before you go, Mr. Geerens. What are your prospects for the global airline industry amid the flurry of vaccine shipments?
Of course, we've got 50 million tons of air freight around the year, and the vaccine is only very limited. We expect about 10,000, perhaps a few 100,000 tons of vaccines. So that's not the most important thing. The most important is that the cargo flights keep flying, although there are no passenger flights. And we see even an increase in air cargo because it is very important for the international trade and the economy that we can still do business and transport all the goods. And that's why we see an augmentation in air cargo, in the air cargo industry.
Right. All right, Mr. Geerens, thank you very much for making the time to join us live at this very early hour at your end.
Okay, thank you very much.
Right, back on the local front, it's time now for the regular briefing on the COVID-19 situation here in the country for this Monday. As mentioned earlier, social restrictions have been slightly eased starting today until the 28th of this month. The briefing is about to start. We'll come back to you afterwards.
그럼 먼저 정은경
We
청장의
have Commissioner
설명이
Chung
있겠습니다.
Eun-kyung with the explanation. Let us now begin our regular briefing, and we will be explaining to you about the vaccine rollout plan for February and March. And we announced the plan for vaccinations on the 28th of February, and our committee members also reflected the various plans and details, and we have provided a detailed guideline for the vaccine rollout plan for March and February. And this plan was based on the committee of our experts, as well as the review and screening given by the experts as well. And we have agreed that all of the cluster infections, as for those people below the age of 65, especially those in the nursing hospitals and nursing homes, they will be administered with the AstraZeneca's vaccine. And for those above the age of 65, we will be inoculating them with these doses of the vaccines, and the final will be decided based on the screening and analysis of by the experts. And we also said that the Ministry of Food and Drug Safety has reviewed the AstraZeneca's vaccine clinical results data, and also we have been looking into the comprehensive data, and we have reviewed these data comprehensively. And the experts committee has said that AstraZeneca vaccines, including our country and along with other countries like 50 other countries, including UK and many other European countries, has received emergency approval. And we also have identified the safety of the vaccines for those above the age of 65. And we also have been seeing the efficacy rate of these vaccines to treat those in the high-risk group. However, as for those above the 65, we have seen some significant aspects of these figures, and we also see that those with above the age of 65, our Korea's Ministry of Drug Safety also says that the decision must be made cautiously, and this is why we have reflected such data, and we believe that we need to also increase the vaccination rates, and we also believe that we need to also decide the fact that having a halt in these vaccinations for those senior citizens could also be a halt to the nation's wide range vaccines, and therefore for those over the age of 65, we have decided to inoculate them after we have the final decision by the experts committee. And moreover, as for the virus vulnerable facilities, including nursing hospitals and long-term care centers, we will be revising and devising such policies going forward. And as for the caregivers at these policies, we will be giving out the vaccines, the AstraZeneca's first doses of the vaccines, starting from the 26th of February. Moreover, upon our vaccination plans, we also have the high-risk group hospitals and about 35,000 people, the caregivers, and about 78,000 caregivers as well. We will be giving them the first dose of the AstraZeneca's vaccine as well. And together with this, from the COVAX vaccine facility, we will be having the Pfizer's vaccine to arrive in South Korea as well, and they will be given by the inoculation center at the National Medical Center, and they will also be given out to about 55,000 people, which include the health professionals who care for COVID-19 patients. And we will also be giving out a tailored tailored vaccination plan for each of these groups. And as for the long-term care centers and nursing homes, they will be carrying out their own vaccination plans. So we will have the health providers visit these facilities, and depending on the mobility of these residents, we will also have the public health center as working as the venue for the vaccinations as well. And as for the Pfizer vaccine to be given to the health providers to treat COVID-19 patients. We will be giving out them to the designated COVID-19 hospitals. And as for to minimize any damages to these the vaccines, we will also have these vaccination centers at each of the regions, which will be working as the venues of inoculation. And we hope that we will overcome the COVID-19 prolonged battle, and we believe that it is very important to have the public's participation in order to protect our senior citizens as well as establishing herd immunity. We ask you to get vaccinated as well.
질의응답 시간을 지금부터 갖도록 하겠습니다. 출입 기자단으로부터 받은 먼저 5가지의
We will be giving us some Q&As, and we will also have 5 questions that have been received in advance from the journalists. So here is the first question. Last week, the WHO committee says that aside from regardless of the age, AstraZeneca vaccines could be administered. However, why is the reason behind this decision based on the inoculation for those under the age of 65? As for the experts committee meetings, we had these diverse rounds of the meetings, and we also had the screening process, and we discussed this matter. And at both of these meetings, we said we discussed the issue of vaccinating those over the age of 65. And there were also opinions where people also said that we need to wait until we have the detailed and clear efficacy rate for the vaccine for those over the age of 65. And as you all know, the AstraZeneca vaccines has been approved by all adults above the age of 18. And as for the safety of these doses, this also has been clarified as well. And they also have been clarified to have developed antibodies as well. However, we believe that we only have 660 people who are the subject of the clinical trial, meaning that we do not have a large study target as well, and we believe that it is very difficult for us to bring out a very meaningful and significant data. And we believe that after we have some very scientific proof, we believe we felt confident that after this scientific proof, we can proceed with the vaccines with confidence. So that is why we decided to vaccinate those under the age of 65 first, and then proceed with those senior citizens afterwards. And this was the first question as well that has been received. The committee also says in relation to the AstraZeneca, we believe that there were 2 options as for the AstraZeneca vaccines. What was the vote turnout for these 2 choices, and what was the committee's response for any risk factors? So our expert committee meeting, we have 15 expert panels sitting on the panel, and we had 13 who were present at the meeting, and about 10 of them said that we need to inoculate those people aged over 65 after we have the more profound scientific proof. And also in our committee meeting as well, there were diverse opinions. However, as mentioned just before, this vaccine, the efficacy and the safety rate has already been clarified and proved, and we believe that we have the analysis that this can be effective in treating and preventing people to develop severe symptoms. So this was our basis. And this was the third question that we have received in advance.
Right, that was Chong Young with Monday's afternoon briefing that seemed focused on the country's vaccine plans. So there's been a significant shift in the government's plans for AstraZeneca's vaccine for those aged 65 and above.
Right, that was probably the question that many people had on their minds regarding AstraZeneca. And it looks like people aged 65 and above will as of yet not received the AstraZeneca vaccine because, according to Tong, a little bit of more analysis looks to be needed before that decision is finally being made. And she said that experts who discussed this issue had some divided opinions, and the AstraZeneca vaccine was approved for everyone above the age of 18, but when it comes to the efficacy of the vaccine for people aged 65 and above, there is just not enough data because of the lack in participants for the clinical trials. Meanwhile, as earlier mentioned, already on the 26th, the first vaccinations will kick off, and the first people who will receive the shots will be medical workers and other people working at high-risk facilities such as nursing hospitals and other hospitals where there are many seniors. But again, not the seniors will be receiving the AstraZeneca vaccine, but the people who work at such facilities. And Tong also mentioned she asked for cooperation from the nation's people once the vaccination program begins so that we can achieve herd immunity as fast as possible.
All right, so thank you for that. I'll see you again tomorrow.
See you tomorrow.
Also, in related news, the pandemic is having an unprecedented toll on our mental health. And in this following report, we take a look at government efforts to address the psychological impact of COVID-19.
The COVID-19 pandemic has had serious implications on our mental well-being. According to a recent survey, nearly 8 out of 10 small business owners in Korea reported symptoms of depression and fatigue amid their struggles in the crisis.
코로나 블루, 코로나 우울 이렇게 말을 하면 사람들이 그냥 우울증만 생각하시거든요. 근데 이런 스트레스는 우울로만 나타나는 건 아니에요. 되게 예민한 반응으로 나타날 수도 있고 굉장히 불안정성, 그리고 감정의 조절이 잘 안 된다든지 몸으로 나타날 수도 있습니다. 몸이 막 여기저기 아프고 소화도 잘 안 되고 이런 피로감으로 나타날 수도 있고요. 그래서 스스로의 이런 반응들을 잘 좀 체크해 보시는 게 먼저 첫걸음이 될 텐데, 이제 국가 트라우마 센터 홈페이지나 카카오 채널, 그리고 정신보건과 관련된 각 이제 지자체의 센터가 있습니다. 정신건강복지센터에서 홈페이지라든지 각 한라인을 통해서 이제 평가나 상담을 받으실 수가 있어요. 그래서 그런 것들을 먼저 좀 확인해 보시면 좋겠고.
We visited the National Center for Disaster Trauma to learn how they're helping people who are struggling mentally.
저희 국가 트라우마 센터에서는 이제 확진자 가족 그리고 유가족분들에 대한 저희가 코로나 심리 지원을 진행하고 있고요. 그리고 이제 저희가 한라인 24시간 동안 이제 전화 상담을 통해서 이제 심리적으로 힘드신 분들에게 이제 심리 지원을 진행하고 있습니다.
The center operates mobile mental health clinics that can be deployed to disaster-affected areas or the homes of people with mobility impairments. These buses are outfitted with medical equipment that can measure stress levels, and healthcare workers on board also provide relaxation therapy and counseling. In addition, the National Center for Disaster Trauma has also developed an app that people can download, which helps them cope with pandemic-related stress. The center's homepage also provides an abundance of information on self-diagnosis and coping mechanisms. Telephone counseling has mostly replaced in-person sessions due to the pandemic.
감사합니다. 코로나19 통합심리지원단입니다. 네, 혹시 코로나로 확진되셨나요? 혹시 수면이나 이런 거는 괜찮으실까요?
The counselors at this call center have a difficult job, but they say nothing is more rewarding than to help someone who is struggling with depression.
코로나로 인한 이제 휴우증을 호소하셨던 분이신데요. 주변에 가족들을 힘들게 하고 그랬던 이제 분이셨는데 저를 통해서 이것이 코로나 휴우증이고 일시적이라고 하는 이제 그런 이야기를 들으시면서 이제 본인이 괜찮아졌다 이제 이렇게 이야기를 해주셨던 분이 있으셨습니다.
The center is also developing new content to improve their mental health care response in disaster situations, and has also launched a campaign to raise public awareness on mental health issues.
저희가 작년에 개발한 자료들, 지침들이 49종입니다. 이 장기화되면서 취약계층, 어린 아이들, 또 외국인들, 뭐 장애인들이나 의료진들에 대한 각각의 메시지가 굉장히 중요해졌거든요. 단일 재난에 대해서 이렇게 많은 지침을 저희가 만들었던 게 처음이고 또 이제 소진 프로그램도 진짜 실제로 구축을 하고 실제로 운영을 하고 이런 것도 저희로서는 큰 성과라고 생각합니다.
The Korean government has also responded to the country's growing mental health challenges, pledging to invest roughly $1.8 billion towards this cause over the next 5 years. For those suffering from depression amid the pandemic, help is nearby. And if you're feeling okay for now, don't forget to exercise prevention.
그동안 해오지 않았었던 다양한 스트레스 대처 방식들을 좀 찾아야 됩니다. 그런 과제들을 찾기 위해서 적극적으로 노력하시고 그런 좋은 어떤 아이디어를 서로에게 선한 영향력을 좀 나눌 수 있는 그런 네트워킹 이런 것들을 적극적으로 하시는 것 이런 것들이 상황들을 좀 극복하고 나의 심리적인 안정을 유지하는 데에는 좀 도움이 된다는 말씀을 드리고 싶습니다.
The pandemic can often feel overwhelming and stressful, so remember to pause, reflect on your emotional state, and get help if you need it.
이번 조정 방안의 핵심은 문을 닫게 하는 방역에서 스스로 실천하는 방역으로 전환해보자는 것입니다. 모레부터 2주 동안 우리는 자율과 책임에 기반한 방역을 과감하게 시도합니다.
이번 조정은 코로나19 장기화로 인한 서민 경제 어려움과 사회적 피로감 등을 고려한 불가피한 결정입니다. 만약 3차 유행이 다시 확산되는 경향이 나타나면 정부는 거리두기 단계를 다시 상향할 수밖에 없습니다.
In their briefing on this Monday afternoon, authorities shared details regarding their vaccination campaign, which is poised to begin on the 26th of this month. Now, for more on this, I have Dr. Alice Hyungyong-Tan from Ms. Medi Women's Hospital. Good to have you with us again, Dr. Tan.
Thank you for having me.
And I also have Dr. David Kwak from Soonchunhyang University Hospital. Good to see you again, Dr. Kwak.
Good afternoon.
Dr. Dan, we ended last week, well, the work week last Wednesday, with the government's green light on AstraZeneca's vaccine for those aged 65 and above. We have a reversal this week at the briefing this afternoon, with authorities saying that those aged 65 and above will not receive the AstraZeneca vaccine. What are your thoughts?
Well, you know, if it weren't a pandemic, given the data that we have from the phase 3 trials, would the AstraZeneca vaccine, would it have been approved for that population? I don't think so. Just because the numbers enrolled in the trials, the numbers were not large enough to give us what we call in the scientific community statistical significance. That's what we're looking for. And just the numbers were not there due to enrollment issues. And so that's why I think they're pausing a little bit. They just want to wait and see until we get some more information. There is another leg of the phase 3 trial that is ongoing in the United States, and we will be having more information from that trial soon. I understand there may be 6,000, 7,000 elderly participants who are expected to be enrolled in that trial. So it does make sense to wait for a little bit more information before we go forward. The last thing that we want is to introduce a vaccine into the population that people don't feel comfortable receiving, and then the uptake will be low. And then it just works against us. So I think it does make sense to pause that decision a little bit.
Right. Dr. Kwak, what are your thoughts on the matter?
Well, I agree with Dr. Tan 100% on this matter. Usually when we implement certain medical procedure or treatment, there has to be a certain proof that we can base the treatment on. And currently, we're just lacking the proof at the moment. I'm not saying the proof is
against the use of the vaccines, but rather we have to wait until enough evidence has accumulated that we could base on to apply these medications for general public. But also, we have to consider many other countries around the world that have inoculated with AstraZeneca vaccine have also shown some peculiar results too. For instance, South Africa has temporarily halted the use of AstraZeneca on all generations of population for themselves for the reason that the AstraZeneca particularly were not able to show a stopping of progress towards moderate and mild disease of COVID-19, even in younger generations. We have to also take that into consideration. But at this moment, temporarily stopping or delaying the use of the vaccine to people above 65 years of age is, I think, a very legitimate idea that we have to wait until further results from further clinical trials come up.
Right. Dr. Tan, do you see this latest decision by the government to hold the vaccination of those above 65 and above with the AstraZeneca vaccine as affecting perhaps our priority list? Because among the first to be inoculated were healthcare workers and those aged 65 and above. What are your thoughts?
Right. So unfortunately, this has to do with what vaccine will be available. I mean, had we the Moderna or the Pfizer vaccine, I think we could have started rollout in that highest risk population, people above the age of 65. Unfortunately, what we'll be getting in first is AstraZeneca, and so that's why the priority list has been shuffled just a little bit. That being said, people in long-term care facilities, if they are below the age of 65, then they will receive the vaccine starting on the 26th. And also staff, people who work in these facilities, if they are less than 65 years old, they will also be getting the vaccine. So there has been, it's a little bit of a shift, a little bit of a pivot, but I think overall, we are prioritizing safety over speed. And I think it was the right decision.
Right. Dr. Kwak, authorities are planning to inoculate 10 million high-risk people by July with the aim of securing herd immunity by November. Is this a feasible plan?
Well, I would certainly hope so. I have no particular knowledge in regards to what are more available globally at this point. But we certainly do have a variety of options that we can even still pursue to purchase. Meaning not just the Pfizer and AstraZeneca that we currently know, but Sputnik or Moderna or Johnson and Johnson and Janssen and Novavax. All these different types of vaccines are still out there that we could make deals with. So I think the government could try harder to actually purchase more and more vaccines that are being proven to work against even the new variants and also show a great efficacy in all the generations. So time-wise, November, whether that be November or September, I don't think that really should matter at this point. We just need to get our hands on as many vaccinations as possible so that sooner or later we could get everybody inoculated.
Right. Meanwhile, Dr. Tan, what is your assessment of the current COVID-19 situation here in the country as we have just come out of a long weekend holiday to mark the Lunar New Year?
Unfortunately, I think we may have already hit the nadir, in other words, the lowest point of several key indicators of COVID-19 activity. For example, the lowest number of cases of unknown epidemiological link, that was on February 6th. That was 1,223 cases. The number has since gone up since that. And then in terms of the daily domestic cases, that total was 264, the lowest number, and that was February 8th. And then February 10th saw the lowest number of total active cases, 8,218. And unfortunately, it's sort of back to back, we hit these lows, and then since then we've sort of seen a climb. So whether or not this is the start of a fourth wave or we're now at this precariously high baseline level, it remains to be seen. However, as I said, it is precarious. We do need to be on high alert. Furthermore, we've seen the reproductive number now get to about 1, maybe exceeding 1 in the Seoul metropolitan area over the last 6 days. 4 of those last 6 days, the number of patients diagnosed in Seoul was above the average for the last week in terms of daily new cases. And so, unfortunately, I think the direction that we will be going in, especially in light of the fact that we have eased now measures, all of the highest risk facilities, all of them will be open for business starting today. So it's almost inevitable that we will see more cases. The question remains, in terms of the more than 700 ICU beds we have available, how fast and how many will these beds be filled? I hope that people will, really adhere to the individual infection control measures that they need to, take seriously so that we don't go in that bad direction.
Right. Dr. Kwak, keeping in mind what Dr. Tan has just said, what are your thoughts on the government's decision to ease social restrictions here in the country?
Once again, I completely agree with what Dr. Tan just said. I think it's really in our minds. Whether the government takes a notch up in the social distancing level, or even if they lower it, if the whole population, us as citizens, were keeping the most strict social distancing measures, we would not be so much worried. But that's not the case, and everybody's really growing tired of all these preceding pandemic. So I do also expect to see the numbers go up, but hopefully it'll not go up too much. Let's put it that way, so that it'll be still manageable. And once the numbers start to go up and everyone realizes that we're heading back towards where we just came from, people will go back to being more scared and being more careful, not to really socially mingle anymore. But what I wanted to emphasize was that it's a mentality. It's what we seem in people so that they could react to this. If the government sort of gives away hints and tips that, oh, we're easing off, we're going into the easier phase now, people will definitely react on it and start to come out more. So we have to keep a very good balance in between how we're going to have everyone be on an alert, but yet not grow so tired of it. So I think it's a tough job that the government is currently taking. But unfortunately, I think we are going to see a little increase in the numbers for a little while.
Right. And staying with this grim forecast, do you foresee, Dr. Tan, a resurgence in light of the recent holiday as perhaps negatively affecting our inoculation campaign?
Well, ideally we would like to have the number of total daily cases less than 300, just to keep the situation safe. I mean, we want a low incidence because at the end of the day, it's just one agency, the KDCA, that's taking care of both the countermeasures and vaccine rollout. And if we have this agency stretched, overwhelmed as they were at the peak of this third wave, then it's going to be very difficult to make sure that the vaccine rollout is safe and smooth. I mean, the resources will be running very thin. Also, this mass vaccination campaign inherently involves a lot of mobility, a lot of moving around and gathering, right? People are going to be moving into these vaccination centers to get their shots. And so that inherently ups the risk a little bit. And so if we do see a spike in cases, it will become much more challenging. However, I don't think that, up to a certain degree, I don't think that an increase will stop or delay significantly our planned rollout, especially because that revised first tier now, these are people who are in long-term care facilities, people, the residents and also the staff, and so we will have mobile teams going to them for the vaccinations.
Dr. Kwak, as of this past weekend, Korea has recorded 88 cases of coronavirus variants. Now, I suppose these variants will continue to remain a threat to us even after the start of our inoculation drive.
Yes, Well, that's one of the things that I'm mostly concerned about. The new variants really coming into the country is inevitable, I think. It's popping up everywhere globally. It's popping up in the US. Well, they're really just mixing up in the US, I think, because everyone is really traveling there. But also for us, we're having people come over from not just Brazil, not just South Africa. We're actually having people come over from everywhere. So it is inevitable the new variant will take dominance sooner or later in the country. So we need to have a plan to fight against those as well. It's really as long as we keep our national border even slightly open, something is going to come in and start taking dominance. How much time will it take? We do have to have a plan, but vaccination and keeping social distancing is probably the most powerful and the only measure that we could take to mitigate those viruses. At this moment, with the number of vaccinations we have at hand, we are certainly going to take that tool, but it is going to be limited. The second best choice would obviously be keep socially distancing. So I think for the time being, we still have to re-emphasize to the whole citizens that it's still very vital and critical that we keep socially distancing for a little more so that enough time will be taken, we have everyone inoculated and be safe from the virus.
Right. Dr. Dan, also this past weekend, Korea noted its first COVID-19 fatality of a patient in his or her 20s. How deadly is the disease with regard to young adults?
Fortunately, in our country, for people less than 60 years old, the case fatality ratio has been relatively low. So for people in their 50s, it's 0.31%. People in their 40s, it's 0.1%. We go down a decade, people in their 30s, 0.06, and then in their 20s, we had only one case, 0.01%. This fatality, however, does highlight, I think, a very tragic consequence of this last third wave. We had an unprecedented number of fatalities in people less than 60 years old. And when we look at the impact of a disease on a society, one factor that we take into account is something called years of life lost. So if a person who has exceeded their life expectancy passes away, however sad it may be, the overall impact on society is not as large as if a person who is in their prime passes away due to a preventable disease. And so this most recent fatality, it did shock me a little bit. However, when we look at the statistics overseas, I learned that in the United States, as many children died of COVID-19 since the beginning of the pandemic as died from influenza for the 2019-2020 flu season. And also in France, when they look at adolescents between the age of 11 and 17, they found that the in-hospital mortality was actually 10 times greater for COVID-19 adolescents compared to that same age group in the hospital for influenza. So the case fatality ratio is low in our country. However, we need to keep in mind that even children, even young people can die of this disease.
Right. And Dr. Kwak, remind our viewers, please, about the safety measures that need to be practiced by those who have been inoculated.
Well, it is being said that we still have to keep wearing the mask and keep all the socially distancing guidelines. I just would like to emphasize once again the 3 W's here. Watch your distance, wash your hands often, and wear your mask. And that still has to be kept even after inoculation, as guided by the different governmental agencies all over the world. So for the time being, even if we see the vaccinations being inoculated in the near future, it doesn't necessarily mean that we're going to be completely safe from the virus for any time soon. So let's keep in mind socially distancing is yet the most powerful tool that we have at hand that we have to keep.
Right, and Dr. Dan, what would you recommend as part of efforts to ensure a safe and practical response to the pandemic this week?
Right, well, this upcoming week, as I said, we want to just push the numbers down, keep suppressing the COVID activity as much as we can. People, now that they've seen the number from 2.5 to 2 go down, they may feel this sense of liberation that they can go out and socialize. That's absolutely not the case whatsoever. I mean, New Zealand, just over the weekend, they went into level 3, that's almost lockdown, because they detected a mere 3 cases in their community. We had more than 100-fold that number, and yet, we are enjoying a level of freedom that many countries are not able to have. In order to keep the level safe, as Dr. David said, we need to watch for the W's, the 3 W's.
Right. Wash your hands.
Watch your
hands.
distance.
Wear
your mask. Keep your distance, yes.
Right. All right, Dr. Dan, as always, thank you very much for your thoughts. And Dr. Kwak, thank you for your insights.
Thanks.
Right, and on that note, we end Monday's edition of COVID-19. Join us tomorrow for more coverage on Korea's upcoming vaccination plan. In the meantime, do stay safe and thank you for watching.